What do you see driving the uptick in connective tissue problems? I hear a lot about Lyme and Bartonella with this.
I think that these problems have been there for a long time. A lot of people have a genetic disposition to it. I'm talking about weak connective tissues or lax ligaments, but they've been exacerbated by immune dysregulation. Mast Cell Activation syndrome will do that. It will actually tenderize the ligaments, the lax ligaments. So now we have to go back and look at that. Well, why are people sick in this way now over the past 20, maybe 30 years in a way that they haven't been? I think a lot of that has to do with the combination of environmental toxins, inflammation from that interacting with inflammation from infections, that then starting to cause inflammation in those weak connective tissues or lax ligaments. It's not that lax ligament issues is a new thing. It's that the way that those lax ligaments are now being exposed to inflammation, I'd say that's new. So we're seeing a lot of this in our practice now.
Yeah,
for sure.
You know, the Richie Shoemaker started to write about this ligamentous laxity as a co-factor in risk of sensitivity to mold back in the early 2000s. And, you know, something has happened, okay, in the last 40, 50, I mean, in the diseases of inflammation, the last 100 years have skyrocketed, okay? Cardiovascular disease, which is, its essence is inflammation of the blood vessels, okay? That's how you get, all the cholesterol, that's all secondary stuff. It's inflammation that starts the problem. And that was a rare disease in the 1800s, and they knew how to recognize it just fine. Okay, it was a rare disease. It started in the early 1900s, a little bit, 20s, 30s, and then it started to take off along with cancers. So toxins have a huge effect here. Okay, and they're getting worse and worse as people and as Dr. Parpia was saying, anytime you add toxins, you cause inflammation, and inflammation is what actually tenderizes. It's a great way to say it. The ligaments. So I don't think that the ligaments are getting worse. I think it's the inflammation. It's a real, and everybody has their favorite target. It's the vaccines, it's the EMFs, it's all of it. I think when you look at epidemiology, which is like the study of like in populations, and you try to point out like this is the cause, you can get all kinds of correlations that aren't necessary causation. But we can see that whatever we've done to the modern world has not been good for our health.